yeah, that big old green
That's a good
spot.
one.
He's got a corneal ulcer.
Oh.
Sorry, buddy.
1 week later.
Really hold her, even though it's really
Gotcha. It's still there.
A week and a half later.
So Jacques has returned. We've been treating his ulcer for about a week and a half, I think. And it has become, and it may have been this kind of from the start, what's called an indolent ulcer. So an indolent ulcer is where essentially the ulcer heals the upper layer of the cornea without actually healing the underside, and so that ulcer stays. So we have to remove that upper layer of epithelium, so we expose that ulcer, that the underlayer again, so that we can try and get him on this path of healing. One of the ways that we do this, I did it a week and a half ago with little Q-tip, but really the better way to do it is using this diamond burr. So not all dogs have to be sedated for this, but we sedated Jacques. This is a diamond burr, and at the top of this has little tiny specks of diamonds that you can run across the surface of their cornea to help get rid of that. And it goes on this nifty little, and you turn it on and it, I don't know if you'll be able to see it, but it lightly vibrates. Oh my gosh, I can touch his face. All right. Proparacaine just numbs his eye a little bit. I wouldn't say it's really much worse, but it's not any better compared to before. So we'll do a little diamond burr action on it. Try and get it better, and it takes longer to heal when you do it that way, or maybe I give it a longer time because you really just cleaned off. You do the entire surface of the cornea, not just where the ulcer is. I'll get him eye drops and we'll do an oral antibiotic. Doxycycline is the only antibiotic that will get into the tears. So that'll then also coat the eyes. So we'll do both an eye drop and oral and some pain meds as well for 2 weeks. Leave him on all of that and then recheck him in 2 weeks. So you can kind of start to see some of that coming up. A little stringiness there. See that? That is removing the epithelium off of his cornea, so we can get a fresh bed of tissue to start healing. Most dogs get better when you do it the first time, and then there's a subset that they need it a second time, and if he's not any better after that, so when we send him to the ophthalmologist and they can do surgery to actually fix it. But some corneal ulcers are very superficial. You can get them to heal. You don't have to do this, but then some of them end up like this, that you have to get to this point so you can remove that tissue. So if it's not any better, we'll send him on to the ophthalmologist, because I've kind of already done something similar just with the Q-tip.